So we'll go have a chat to her. What room is she in? 3. 3, okay. Now, Taylor said you thought maybe she'd eaten about 10 raisins or so. Yeah. So there's at least 30 that's come up.
Oh my God.
Yeah, yeah.
Like, thank God I brought her in.
Absolutely. One thing we really try to do is build resilience in the team. These guys deal with life and death every day, and it's important that we teach them that it's not about winning or losing, it's about what we learn from each case that we treat and how we're going to do things better next time. So we're going to look at a little patient that I've got in hospital at the moment. Her name is Bronte, and she came in yesterday. Hey darling. She's only a young girl, she's only about a year old, but she has started to have seizures yesterday and we don't really know why. We've done a couple of tests on her today and they've come back clear, which is good. Probably what's going to happen tomorrow is that she will actually have a scan of her brain to see if we can see what might be going on in there. But she's a beautiful girl. Aren't you okay? The tricky thing with this is this dog has eaten one of those little disc batteries, and those ones are really serious. They can literally melt through the intestine, and so we have to, becomes very time dependent to get that little object out of there before it does too much damage. It's pretty obvious there on the x-ray. Judging from this view, I think it might be in the large bowel, which would be a good thing, but what we're going to need is a second view to confirm that. So whenever we take x-rays, we always need what we call an orthogonal view, so 2 views, usually one coming in from the side and one from this direction, and that enables us to pinpoint exactly where an object is, so then that helps us make the decision about what's the best way to manage it. So on the other view we can see, yes, it definitely is in the colon, so in the large bowel, the very last part of the bowel before it comes out. Now the good news with that is that that's likely to pass just with medical management, so we'll give a couple of hours to see if it'll just travel through.
So we've had an ingestion of sultanas. She's had probably roughly 10 grams.
Okay.
So we probably have to check the toxic dose of that one, but I'd like to induce emesis as soon as possible because it's been roughly 2 hours.
It's still definitely worthwhile inducing vomiting, even if it's been a couple of hours. Be surprised even 12 hours later, sometimes we get things from the stomach. So that injection usually only takes about a minute or 2 to work. And it's a little bit unpleasant for the dogs, but it basically will cause them to feel very sick. They'll start to vomit and hopefully bring up what's in the stomach. Usually we estimate that between 70 to 80% of stomach contents will come up. Occasionally it won't be effective and they won't vomit, but majority of the time it works really well, and hopefully what we want to see is some sultanas come up. It's interesting the difference between what the owner thinks they might have eaten versus what they've eaten. So I think this lady said she thought that she might have eaten about 10 sultanas. There's at least 20 here. I'm just going to give her an injection now to stop the vomiting because she's emptied her stomach. She's really just vomiting fluid now, so we need to make her feel a little bit better.
28. That's a kidney toxic dose.
Yeah. We might just leave her here just to get over her. She's feeling pretty sick still, and go and have a chat to her mum. We need to probably advise that she comes into hospital, goes on a trip overnight. Biggest concern is damage to her kidneys. I think he's actually dislocated that last joint of his toe. So what we're going to do is straighten it back up again, so relocate it back in the proper position, and then we're going to splint it with the adjacent toes, and that will hopefully stabilise it. And cats hate bandages, unfortunately, but even if he manages to keep the bandage on for about a week or so, then hopefully that toe will stabilise and he won't need any further treatment. I think it's important that you're able to leave after each shift and be content that you've done everything you can to make the difference in the life of a pet and an owner, because if you get too attached to the outcome, the reality is that not every pet makes it, And so the important thing is to focus on the difference you've made. Otherwise it is really hard to shut off after a shift. Because when you leave here and go home, that's the time to be present for your family, for your kids, because that's what's going to make you a better vet. They're going to take this little girl home tonight. Now that's fine. The main thing is that we've induced vomiting and we've got what we think is the whole packet of raisins up. The main concern with raisins is that they can cause a reaction in dogs that can cause renal failure, so kidneys. And so we're always concerned, and because there's no set toxic dose, some dogs can develop issues with their kidneys even with a couple of grapes or raisins or sultanas, and other dogs can tolerate much more, and we don't really know what the toxic factor is. So we always are ultra cautious. We'll always induce vomiting and generally recommend intravenous fluids at the same time. But in this case, we've induced vomiting and brought up what we believe to be the whole packet of raisins. Thank you so much for joining us in the hospital today. I hope you've enjoyed watching some of the cases that we've had through. Comment below and let us know what you've loved watching, what you'd like to see more of, and we'll see you next time.